Greetings. This weekend at the Payette Seventh-day Adventist Church, we were blessed to have speaker Walt Cross, who specializes in the health message, present to us. And we're living in a time where a lot of people are, especially on YouTube, attacking Adventism, calling us a cult. One of the things they're saying is Ellen White is a false prophet. Well, one of the things that we are seeing now is that inspired guidance that she gave, especially concerning the health message, has been repeatedly proving itself to be true. I remember years ago, this National Geographic special on The Secrets of Living Longer came out November 2005, and it was really dealing with blue zones, areas of the world where people live longer. And so they had a blue zone in Japan, Okinawa. They pointed out that, page 16. Then they talked about the Sardinians. They talked about the Sardinians, actually before that, starting there, page 10. Sardinians. One of the points they made on page number 9 was that these three groups, the Sardinians, the Okinawans, and the Adventists. These three groups had in common: all don't smoke, put family first, be active every day, keep socially engaged, eat fruits, vegetables, and whole grains. So those were some of the things that all three groups had in common. When Ellen White had given guidance on health, and the Adventist Church had taken the health message seriously throughout its history, we can see now the results of healthful living, the world that we live in. So they have the Adventists spoken about there. 6 and 7 says, Loma Linda, California, last year when she turned 100, Marge Jedden renewed her driver's license for another 5 years. But what truly keeps her going, she says, is her Christian faith. Now, we're living in a time where a lot of people are saying, well, Adventists are a cult, they're not Christians, and Ellen White is a false prophet. But that guidance she gave on health has clearly revealed itself to be true in the life of Marge Jedden, according to what I'm reading here, being 100 years old. And so it goes on to say, she and other Seventh-day Adventists who avoid junk food and caffeine tend to live 4 to 10 years longer than the average Californian. We need someone to guide us in this life, and we need great hope, she says. God is a good friend to have. So it's things like this that really are showing the world that, yes, the Adventist health message is very important, this holistic message. And the Bible very plainly tells us in 1 Corinthians 6, 19 and 20, that the body is the temple of the Holy Spirit. So it was a blessing to have Walt Cross come by and share a lot of information. So that's what I'm going to be presenting here. He did some long presentations. I only got 2 of them. But he spoke about these books of Ellen White, Mind, Character, and Personality. That's Volume 1, Volume 2, Medical Ministry, Ministry of Healing. And I believe that health is going to play a major role in the end times. And by the grace of God, we have the health message to share with the world, and it's all based on the Word. So I hope these presentations are a blessing to you.
Or you turn them around and you go up and down your spine. Just go up and down the spine with plumb cold. And if you got a well, that's going to be nice and cold. You don't have cold water here. But you take that up and down their spine with cold water and they're in depression, let me tell you what, they come out of that pressure pretty fast. And wakes them right up. And so we don't use that kind there where it's stationary. We'll just use that hose and work that area. And so you can work an area where that pressure is like a massage, but yet you're getting the contrast in heat, or if you're wanting contrast, or if you're just wanting heat, but you've got that volume of water penetrating that, which is doing massage, but at a specific temperature, or you can do your alternating hot, cold, hot, cold. Thanks, sir. Why do they have those tarps across the top? Do you see spigots? That's like the old baths, that people remember how they'd say, well, don't take a bath, on Sabbath because it's a lot of work. Well, it's a lot of work. You had to heat the water, a lot of water to put in the bathtub. Well, this is the old days when they didn't have water supply, and so they had to literally carry water and put in there. And when you're doing a fever treatment, if the water drops below the 102, you can just put a little more hot water. It's easy, just turn the spigot. But they don't have a spigot, and to make it easier, they put these what's that material called? Canvas. Yes, and that's what's on that thermoform. That hydrocolor pack is canvas. That's what I was trying to think of. And they put the canvas on top of there to keep that heat in there, so it keeps that water nice and warm. Today we don't have to worry about that because we can just crank a little more hot water. I went down to Tijuana. It's probably been 20-something years ago, and I was wanting to learn more about treating cancer. And there's people who've had to leave America and go to Tijuana, go to Mexico and different places to evade the challenges in America with natural medicine. And there was a doctor there that had a hospital, and he treated patients with cancer. And so I went to try to figure out what was he doing. And he would put his patients in ICU for this treatment. And he would give them a drug that would cause their temperature to go up between 102 and 104. But yet sometimes he'd give them too much, so he'd have to give them another drug to bring them back down into the 102 to 4. Sometimes it would drop too low, so he'd have to give them another drug to get them back up. He was constantly, during this treatment, giving them drugs to go up and down, patient specific. And he'd have to put them in ICU because the drugs were challenging. And I asked him, I said, why do you do that? Why are you using drugs to do this? And putting the patient at jeopardy where their acuity is so high that they have to be in ICU. That's just, people don't need to be in ICU if they don't have to, the acuity level. I said, why don't you do a fever treatment? And he looked at me and said, you're Seventh-day Adventist, aren't you? I said, yes, sir. Why don't you do a fever treatment? He says, it's just too labor intensive. And you're putting that patient through this? Crazy. But he could charge a lot of money, make it sound highfalutin. And this treatment right here will do the same thing that he's doing down at Tijuana with drugs in ICU. Crazy. Here's another one in the Navy doing hydrotherapy. Now, we saw this picture yesterday, I believe. Why are the patients bundled up? Pardon?
Keep the temperature up.
Keep the temperature up. And Loma Linda found Dr. I'll think of it in a minute. He found that after a fever treatment or after a massage, the sauna, you need to put the patients in bed for 2 hours. For 2 hours. And it helps with the immune system. So they bundle them up, keep them warm, and why are the nurses standing guard? The patients usually fall asleep. And when they wake up, they may forget that they're bundled up and try to get up and fall and break a hip or break their neck. So you always stay with them to make sure that they don't fall off. So a fever treatment. And I'm not going to go into all the stuff here, but I want to show you, I won't go into all this, but what it's used for. A fever treatment is used for poor circulation, pain, it can be muscle, pelvic, back, neck, muscle stiffness, general fatigue, congestion of the internal organs, colds, flu. It's going to increase the immune system. A persistent cough, eczema, psoriasis, cancer, malaria, during chills, low immune system, Lyme disease, arthritis, other autoimmune diseases. And the person who wrote this is actually here in Idaho. How many of y'all know the Meisners? Anybody know the Meisners? Yeah, I haven't found anybody yet. They're up they go up to the Sandpoint Church. Lisa Meisner, she used to be Dr. Agatha's assistant over at UT. So this is what we use the fever treatment for. And so how do you do a fever treatment? Fever treatments are real simple. So we'll use this as an illustration. You get a bathtub. First, have the person go to the bathroom, because they're going to be in it a while, and they're going to be drinking water. So have them go to the bathroom first. But if a person's in a fever treatment and they needed to urinate, the therapist would just say, just urinate in the bathtub and we'll shower afterwards, because we don't want them coming out of the shower, out of the treatment. So your water temperature is 105 to 106. And then they get in the bath. You can give them a hot shower to start with, and that will warm you up and kind of speed up the process. And then put them in the bathtub, and it just speeds it up by getting them in that hot shower first. And then you put them in that bathtub, and they sit there, lay there. And you want them to wear the least amount possible. My favorite to have the person wear is a hospital gown, because you want them to disrobe after the treatment, put something else on, and then go lay down. And you don't have to try to pull underwear off or whatever. It's easier just to put a hospital gown on, and that's it. If it's a family member, spouse, or whatever, you don't have to worry. You don't have to put anything on at all. You're going to give them water every 5 minutes, just to take a sip of water to stay hydrated. Take their pulse. If they have issues with hypertension, take their blood pressure every 5 minutes. It is easy for the O2 sat to drop. Y'all remember the oxygen saturation during COVID, the pulse oximeters. And so it's easy to drop because it's hot, and in that water, you've got the pressure of the water, the heat of the water. They're not breathing as deep. Therefore, the O2 sat can drop. And so all you do, there's some lifestyle centers will put them on oxygen, put a nasal cannula on them, run, say 2 liters. You don't need to do that. Just take them every 5 minutes. Just take a couple of nice deep breaths. You don't hyperventilate, just some nice deep breaths, and that's going to get get that O2 sat up. But it's not uncommon to see their O2 sat drop down in the low 90s during this process. You're going to put an ice rag on their head or a bag of ice on their head. Now, these people do not. They should have ice on their head, because you want to keep that brain nice and cool. You don't have to worry about putting the ice on their head until until that oral temp goes up. But you're going to take the oral temp through so every 5 minutes you're taking the oral temp, you're taking their pulse. If they're hypertensive, you're doing their blood pressure, and you're doing an oral temp. Now, do the oral temp before giving them the water, and then give them something to sip on. If they get tachy, their pulse getting really tachycardia, really high, you can just put some some ice on the chest, and that pulse will come right down. If they're hypertensive and they start getting hypertensive, just stop the treatment. Does anyone know the name Bob Jorgensen? Bob Jorgensen, amazing guy. He went all over the world teaching. And he was at a camp meeting one time, and Bob told me this story. We were real good friends. And he went to a camp meeting, and it was the old tent meetings, where they were in tents and people stayed in tents. And they brought a family member that was dying of cancer and was in stage and could not even come to the meetings, was just laying on a sleeping bag in a tent. And Bob found out this man had cancer, and he went to see him, and he asked, can we do fever treatments? And they did, he agreed. The first fever treatment, Bob said he could only tolerate 5 minutes. And it was just too much. His vital force was so low. He was dying of cancer, and he just couldn't do any more. And so Bob stopped. You don't say, well, Walt said do it for 30 minutes. Stay down there. You know, you monitor. What does that patient do? What can they tolerate? And Bob just kept doing it during this camp meeting. It was a week-long camp meeting, and he was able to do more and more. The family went home and did more and more and more. The man lived. God blessed it. That is the only natural treatment they did on this man, and the cancer totally went away. Now, during this treatment, Loma Linda, Charles Thomas, that's the man's name, Loma Linda, he said that the white cell count would go up 7-fold. I didn't believe that. No way. So I had our nurses draw labs at the beginning of the treatment, at the end of the treatment, and then at the end of the treatment, we were having problems with patients being kind of woozy, walking them back to their room to go to bed. And so I had the therapists use gait belts. I don't know what gait belts are. You put them around the waist. And they would hang onto the gait belt and take them. Well, one of my therapists, she thought, well, I wonder what would happen if I poured that ice water down the back of their neck and down their back. Let's see what that does and see if they're less woozy. And so she'd have them lean forward, we drain the water out, and then she'd take that ice water that we were using for the rag, and she'd poured it down the back of their neck, down their back, and whoo, they'd wake up, real good. And then we didn't have problems with them being woozy anymore. It was a great idea. And so what we did is we drew the labs at the beginning, we drew the labs at the end, and actually the white count dropped during the treatment. And then we poured the ice water down the back of their neck, down their back, immediately drew the lab again within 30 seconds. Within that time frame, the white count had already significantly increased above what it was when they started. Then we drew labs every 30 minutes. And we did this for several months on the patients because you wanted good volume and see what happened. Every single patient maxed at 7-fold, just as Loma Linda said, at 5 hours. I mean, it's just like a clock. Amazing. I didn't go a lot past that. We went, I forgot how many hours we did. We didn't do it into days. Dr. Harold Cherney at Eden Valley, he monitored it on a daily level, and he found that it did not come back to normal until 3 days. Now, I don't know the bell curve, but, I mean, that's pretty decent to have an elevation in white count for 3 days. It's pretty good. Now, Loma Linda found that it really made a difference in that effectiveness by having them go lay down for 2 hours after the treatment. That's important. And that's how you do a fever treatment in water. Well, you're always wanting to learn, trying something new. Can anybody think of challenges or restrictions with the fever treatment, as I have just stated? They don't have a bathtub. Yeah. Some people don't have bathtubs. Elderly getting in or out, or both. Absolutely. It's a problem. There are people who can't get in and out. So I've looked for something to use for these two challenges. And I found that in using the far infrared sauna, I can get an oral temp at about of 102, somewhere around 25 to 30 minutes. Now, it's not the water I'm after, it's the temp I'm after. I'm looking for that oral temp. It's not really a temperature, it's like being in a double boiler where you're just warming the body up. The body thinks it has a fever, and when you have a fever, the body raises the white count. So you're just tricking the body. So I can get the same thing with the sauna. Now we're talking about this type of, where the head is out. And you don't want a full sauna where you go in and the head is inside, because you can't cool the head as effectively. You want to keep that brain nice and cool. And so this machine would do the same thing probably. And you want that oral temp to 102, no more than 104. So let's say you've got a sauna like this, which zips. So if their temp goes above 104, like the infrared sauna I use has infrared lights in it, and I have 2 switches, both 700 watt. I can just click one off so the temperature goes down. I can zip out a little bit, let some of the heat out if it goes under 104. Now there are people who do fever treatments as much as 107 to 108 degrees. I do not encourage people to do that unless they are trained to do that. Dr. Agatha would do that at UG Pine with trained staff, trained medical staff. And not that you have to be medical, you just need to be trained to know what you're doing and what you're watching. Getting, a person having a temperature of 107, 108, you've got to really keep that brain nice and cool and know what you're doing there. You don't want to have any brain damage there. So you can do the same thing, and so what you're after is that oral temp of the 102 to 104. Maintain that for as much as 30 minutes, and then you put them in bed for 2 hours. Any questions on? Yes.
So the fever treatment doesn't need water.
No.
You're using the water to get the oral temp up.
That is correct.
So if you don't have a bathroom, you're using that. You said this is a far infrared?
Far infrared.
Okay.
I do.
Infrared is a different thing.
You could use infrared. You could probably use this one too. Whatever the tool is, like a sauna, whatever method you're doing, that can increase that oral temp. Yes, sir.
Ice water at the end is that.
So
necessary or?
exactly. So what Maria had figured out, Maria's from Venezuela, and where Maria had figured out pouring the ice water down, we can't do that with the sauna. So you have to be cautious walking that patient to their bed.
So that has nothing to do with the white blood cell?
No.
It's just to wake them up?
It's just to wake them up a little so that the brain is not as woozy. Yes. Here's some contraindications. If they're too old, frail, experiencing dizziness, exhaustion, dehydration, ischemia, extreme high blood pressure, if they've had a heart attack, this is just common sense stuff. If their pulse is too high, if they're bleeding, why do you not want to do this if they're bleeding? You can bleed more. Pregnant, low oxygen levels, anemia, abscesses. Do not do a fever treatment yourself. Right. Especially in the water. You don't want to drown if you fall asleep. Salt gloves. Has anyone ever done a salt glove? Have you done a salt glove? So tell us about it.
I don't remember, we did it with Dr. Trash.
Yes, Dr. Thrash like that. So a salt glove, I would get these ladies out of New York City. And y'all know I'm just kind of I like giving people a hard time. And you get these highfalutin ladies out of New York City that they come and they were already out of their element because we were in the country. And these ladies would go from their highfalutin apartments to their highfalutin cars to their highfalutin stores, back to their highfalutin cars that had air conditioning, and back to their highfalutin apartments that had air conditioning. And I'd ask them, I'd say, well, what really get them, I'd say, how many bowel movements do you have a day? You know, why do you want to know how many bowel? You know, that really freaked them out. But I would ask them, do you sweat? It is not ladylike to perspire. It's crazy. And so it would take, on average, our females, males, if it's not painful. And so these female therapists would have to do a salt glow. We would do a combination. It would take average 5 days to get these ladies to sweat. They were so clogged up their pores because they never perspired. That was not ladylike. And so a salt, what we would do is we would take, and it is exfoliation. All you're doing is exfoliating the tissue. And you can take salt. Now here's where Morton salt is fine. And you put it in your hand, and you can put some essential oil in it. But ladies, if that patient is recently shaved, do not put peppermint essential oil. You will light them up. So you let the patient do this, and put some more salt and water in there. And you put water in it, obviously, not just salt, like sandpaper. But if they do it and they get everywhere that they can get, and then the areas that they cannot get to, then the therapist gets to, their back or whatever, their legs if they can't bend over enough. And then we'll put them in, we exfoliate them, and then I like, after exfoliating them, doing sauna. And doing the sauna back and forth, and I'll talk about that in a minute. But a salt glow is a great tool, and you just you can use Epsom salt, you can use salt, you can use essential oils, but again, those cautions. So let's see here. Treatments to be used for epilepsy, general tonic, chronic illness of any kind, stimulant for the muscles and nerve or skin. Although it is a stimulant, it also calms the nerves. Cancer and other debilitating diseases, substance withdrawal, edema, cleansing. It's good to open up the pores for a person who is a smoker, and so they can get rid of the nicotine, those pores out. It's really cool. I'll talk about that in a minute. Do not use patients who cannot stand or sit. You can do it on a patient who's bedfast. You just have to clean off. Skin rash, that just makes sense, but some people don't have common sense. They have no more sense at all. Obviously, you're not going to use it on a rash or an open weeping lesion or whatever, but we have to tell people, don't do that. Skin has just been shaved, as we just mentioned. That will light them up. Things to be careful, do not use essential oils such as peppermint in the wintertime as it can chill the patient. Be careful not to use too much pressure. It may irritate the skin like sandpaper. May dry out the skin. Using oil or lotion after the treatment can resolve this problem. Cold mitten friction. You go get something back here. Is there any washcloths? In the island? That's okay. Sure, absolutely. How to use these? No problem. So, cold mitten frictions are really cool. Spouses really enjoy this thing, get their spouse back. So you can take a washcloth, and you fold it, and you can sew it like a pillow. So you can take it, and then just kind of curve it like this, and then sew it like this, and you can put your hand in it. And it works really nice. You've probably seen them like that. Or if you don't, you can just take your washcloth and do it. And as you see the nurse, she's going up and down with cold ice water on her gloves, and she's just going fast. Can you help me again? And so you can take it, and you can, you kind of get the idea, but you're going back and forth real fast with friction. Now, when we do, let's say you're doing fomentations. There's two options, and we'll come to this in a minute, but just to explain cold and friction. The cold and friction, when you're doing the cold in contrast, you can either use something like a hand towel that's cold and just lay it on there, or you can do the cold and friction. And usually spouses like to get each other back this way, just to have fun with each other. And so you dot it down in ice water, and then you do to your spouse. And then I like doing it only for about 15 seconds, put more ice water on it. And then if you want to get the back, you're just going really fast like this with that friction. Stimulates circulation and works real well. Thank you. And so you can do, as this nurse is doing the arm, you can do the trunk, you can do the legs, you can do, the back, the front, and it's a pretty cool treatment.
And that's good for edema?
It can, for edema, my favorite for edema is yes, you can use hot and cold foam. Yes, it will help with edema, where you have the vasodilation, vasoconstriction, vasodilation, vasoconstriction, and you're using that cold to help with edema, yes. And it will get rid of fluids. I also like using just dandelion leaf. Dandelion leaf is excellent for edema. Let's say you've got pitting edema, or you have lung congestion due to CHF. Or pardon?
Respiratory COVID?
Yes. And so I'll use, say, 3 to 4 capsules of dandelion leaf QID 4 times a day. 3 to 4 capsules 4 times a day. And it's excellent for getting rid of lung congestion or edema. And to answer that question with edema, have you ever noticed when, let's say you're checking for edema, a person has swelling in the legs, and the doctor will go and push on it and then let off? Well, textbook is like usually 15 seconds, hold it in, and then let it off. But I've seen folks do as little as 5 seconds. But hold it in, and then let off 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000. Finally, skin pops out to normal. That's pitting edema plus 5 seconds. And then it goes to 3 seconds, well, that's pitting edema plus 3. You're trending good. But if it goes to 7 seconds, then you're trending worse. You have a question?
Well, I was just wondering if you follow it up with warm.
Pardon?
Do you follow up the cold integration with warm?
No. You always end in cold. And
Okay, cold, but are you switching back?
it depends on what you're doing it for. If you're doing for contrast, yes. But there's sometimes we just we're wanting to stimulate circulation, and we just do the cold, and then cover them up so they don't chill. So, hepatitis, anemia, tuberculosis, pneumonia, a lot of lung issues, poor circulation, colds, influenza, bronchitis, upper respiratory tract infections, headaches, fatigue, fevers can be used beneficially for most any ailment and follow any heating treatment. Anytime you do heat treatment, you end with cold to close those pores, because you don't want to leave those pores open for toxins to get in. Fracture. And this is just common sense stuff, but some people just don't have common sense. You obviously are not going to do that on a fractured limb. Malignant tumors, if the person's already chilled, or cyanotic. Cyanotics, you don't have adequate circulation. Also be careful, some people are ticklers. Be careful there. Don't torture them. Ice massage. Did we put stuff in for ice massage? Do you remember? Thanks, man. So what you do is you get you a cup and put ice in it. And then you tear down the top. I'm looking for a victim. So, first of all, you got to get it wet. You can't use it dry. You want to make it wet so it moves real easy. Can you help me? Yeah, short sleeves on. Okay. Let's see here. Can you help me, sir? Yes. Yeah, see, I left the handle on it in the bottom. Okay, what you're gonna do, say he's got his, okay, go ahead and see. No, you're the caregiver and you're a patient. And so he's got his shoulder, his elbow's really painful. And so what you're gonna do is you're gonna take it, and you're gonna go like this. Okay, you gonna try that? Who's ever done ice massage before? Anybody ever done ice massage? It's a great little treatment. And you do it until it starts stinging and burning, and then it goes numb. When it goes numb, you can go ahead and stop.
I can see right.
It's already burning. No, it's already numb, isn't it?
It is starting. Yeah, it's starting to burn just a little bit.
That's right.
Yeah.
Yeah, it's starting to burn, tingle, get numb, and then you can stop. And so physical therapists, thank you. So physical therapists will use this a lot of times for areas, thank you. It might be a shoulder pain. Yeah, it's a pretty cool tool. So here's what we use it for. Muscle or joint strains, acute chronic low back pain, rheumatoid arthritis, depending on the patient, warm application may be better. And it's true, some patients warm works better than others. Let's see here, stimulates local circulation. A patient who's overheated, you can use it on. And so it works really nice for that. I don't just melt on here at the top. If anybody wants to try this, you can try it. But you can get little cups and see, you can take that, put it back in the freezer, and use it again. And that the cup just, I mean, you could use an ice cube, but you gotta hang on to it, it's hard to hang on to it. And you can either use a paper cup or a styrofoam cup or something, and that works really well for that. Again, people will have pain, shoulder pain, elbow pain, or pain in an area. And doing the ice massage can take that pain away temporarily, and it can help. Do not use the patient's chill. Aversion or sensitivity to cold, like patients with fibromyalgia. Poor circulation, Raynaud's. You all know what Raynaud's is. Raynaud's, we see more females with Raynaud's. Have you ever seen ladies in the summertime wearing gloves? It's because their hands are so cold and they have poor circulation. And circulation regulates temperature in the body. Now, you can, for ladies that have Raynaud's, we'll use something like Yohimbe. We use that for guys who have ED. Well, because ED is a circulation issue, and so is Raynaud's a circulation issue. So we use we use that for the ladies to increase circulation in their hands. I just said it. Yohimbe, thank you, Yohimbe. Elderly, small children. Why do we not do this on small children? Very small children. They can't communicate. They can't say it's hurting me, stop. And so it's like if you're doing a mustard plaster, you don't do a mustard plaster on a child under, say, 2 years old or say 3 years old if they can't communicate well. Probably 3 years old is what I do, because mustard plaster, you can permanently scar a person if you leave it on too long. And so we'll talk about that this afternoon. Hot foot bath. Now, hot foot baths are probably one of the most popular hydrotherapy treatments. What we can do is we can turn back here and look back here. And so what we're going to do is we have a person, and can we use you as a guinea pig? Okay, if you can, we'll come over here. There we go. If you can sit here. Can everybody see? So what we're going to do, before every treatment, we're going to what? Pray. Now we're faking the treatment, so I don't fake prayer. I just talk about it. So let's see here. Can you help me? Ladies on ladies, men on men. So I was in, where was I? I was in Bermuda, and this lady had a terrible migraine, and she left her meds at home, and she couldn't even literally move out of her seat. And one of the treatments that we did was a hot foot bath. And I'll show you later what we did on the other. And so I had two ladies come up, and so go ahead and we'll pretend there's hot water in here. And now, hang on just a second. What she's going to do is she's going to take your hands and lift her feet up. You're testing the water. And let me show you here. What you do. Okay, let me show you. So you'll test the water, and then you slowly, with your hands, set her feet down into the water. When you're finished, you're going to slowly bring her feet up, and you pour cold water on it to cool them off. Go ahead and set them back down. And so what you're doing there is you're causing what? Vasodilation. And that pulls congestion of the blood to that area. And in Asia, in China, if I come to visit your house in China, it's not uncommon that you would get me a pail like that with Epsom salt or water, and you put my feet in there before going to bed, and then I dry them off, and it's a treatment that you'll do for me before I go to bed in their culture. It just helps calm the person down so they'll go to sleep. But a hot foot bath is an amazing little tool that can calm people down. And you can do it, you can do a little massage. Let's say your spouse isn't feeling too good, you can go and do that. Let me grab my clipper a minute. So you can use it for colds, for prevention or treatment, chest congestion. That doesn't make sense. We're doing it to the feet. Why are we for chest congestion? Yes, ma'am.
How long do you leave your feet in water?
You can say easy 20 minutes.
You usually have to keep
Yes,
it warm.
you do. Keep it warm. And I'll show you a trick that works really well as we get older. So chest congestion. So how is this working for chest congestion? Yeah, you're pulling that congested blood away from that chest. It's helping with circulation. A flu, coughing, headache, nosebleeds, pelvic cramps, prostate disorders, pain management, release fatigue and nervous tension, warms the body in preparation for any other treatment. Yes, foot cramps. Yes, it does. Foot cramps and leg cramps. It does. It helps to calm down. So what can you do if you want to do a hot foot bath, or you want to do hot and cold foot bath? A lot of people will drag it out to the kitchen or something, but where's a simple place to do it? The bathtub. Yeah, draw your chair up next to the bathtub. And then put your legs over in the bathtub. You can still use a bucket like this so you're not wasting water. Put it in there, and like as you said, it needs to get warmer again. Just turn your bathtub on, get warm water in there, and then turn it off. And that way you don't have to get up, go get water, or spill water, carry water. It's a whole lot easier. I like using the bathroom if there's enough room. Or if you're doing hot and cold, you can do your hot, your cold, your hot, cold, but your water's here, and it's real simple to do it. I use the laundry sink in the laundry. Yeah.
Take a bucket, I draw my water.
Uh-huh.
It's too cold, and I stand up and just walk.
It's easy. It's in that room. You're right next to the water. You're not having to haul it across the floor or anything like that. Yeah. So these are things that we do be hot for. Now, we're going to do contrast. And so now what we're going to do is we're going to do hot and cold. So we're going to turn our bucket a little different to where it's this way. You can go ahead and turn it. And again, we have a prayer with the person. You set the water down and you set the feet down in it carefully. And why are we doing this? Why are we doing this?
Circulation.
What did we learn yesterday?
Relief.
Pardon?
For relief, but you want to bring somebody to Jesus.
Point the sin-sick soul to Christ. That's our mission. And so it might be your neighbor. And the more you put your hands on them and touch them. Now I know society says don't touch people anymore. Isn't that terrible? It's terrible. Now y'all ladies, it's easier for you to touch each other. Us fellas, we're not into touching too much. And that's just the way we're made up. Don't touch me. Just how guys are more so. But ladies, you touch each other. And that is so medicinal. You know, to put your hand on somebody and touch them. As you put your hands on their feet, you're under their feet, and you like softly put their feet in there. That's therapeutic. That is literally therapeutic. Putting your hands on their feet and dropping them down in there. Did Jesus touch people?
Yes.
Yes, he did. He touched men and ladies. And so then you pick it up, you do 3 minutes warm, facial dilation, and then you do 30 seconds to a minute cold. And so you'll just pick up her feet here, move it to the other side, so we'll move it here. Yes? There. It's 3 minutes warm, 30 seconds to 1 minute cold. I like 1 minute, but some people do 30 seconds. It depends on what they're able to do. Some people can't tolerate the 30 seconds. And so, excuse me a minute. Okay. So you're doing 3 minutes hot, 30 seconds to 1 minute cold, back and forth. You'll see people say as little as 3 times. I like 7 times. I want as much as possible. You can do it at least once a day, if not 2 to 3 times a day. That can be very beneficial. And so let's go up here.
The cold water has ice in it?
You can, but be cautious. If a person has neuropathy, y'all know what neuropathy is? Poor circulation. Then due to, one, they can't feel the temperature change. Also, they may not have the vascular flow, the blood flow, to protect them from the hot, cold, and it can damage the tissue. So, let's see here. Now this is the contrast, so let's look at contrast. Why we use contrast. Localized infections, muscle or joint injuries, arthritis, headaches, edema, disease of the veins or arteries of the legs. So that is contrast, so you increase that circulation. So let's say that a person has a fracture. I like using contrast. So they've had a fractured ankle, or you have edema in the ankle, or something that we need to increase circulation. This treatment here is going to increase circulation to either heal the bone, heal the muscle, the tissue, get rid of the edema. I like using hot, cold better for edema than just hot. It helps, hot brings blood in, cold squeezes it out. And so you're squeezing that edema out. And so that's how we do the hot and the cold. Let's see what we have here. So let me go back, and there's another treatment that we do where let's remember the little girl, the high school, the kindergarten girl that we talked about. Mama has a migraine. So what she did is she put Mama's feet in hot water, and then she took a ice cold, and you take a pail. I'm sorry, like the lady in where was I? I was in Bermuda. And so we had ice cold here with 2 washcloths. And you put one washcloth to the back of the neck and one washcloth to the forehead. And about every 3 to 5 minutes, you put it in ice water, squeeze it, and put it on. And just keep doing that. I was in Sacramento. We were doing evangelist, or I was mentioning we did an evangelistic series at Doug's church. And this guy comes in one night, and he says, I have a migraine, the worst migraine I've ever had. And I said, let's go over to the kitchen. So we went over to the kitchen, and we did this simple treatment. It took 40 minutes. The lady in Bermuda, it took 20 minutes. But this man, it took 40 minutes, and the migraine was pretty well gone. The lady in Bermuda, she was able to get up, drive home, she was fine. I saw the man years later with his wife, and he goes, this is the guy that helped me with that migraine I had. It was terrible. When you do this, again, remember your goal is to what? Point them to Christ. And let them know as you pray that it is, Jesus, we're asking Jesus to, to bless this treatment. And as you're talking to them, you can, you're giving God that credit, and you're touching them. That's huge. It really is. Now, don't do this on men, but you can do this to ladies. Ladies like their head kind of massaged. And when you're doing this treatment in the warm water, especially if it's just a hot foot bath, ladies like their heads kind of just massaged a little bit. And I have no problem if Mary does that to my head. I just don't want no man massaging my head. But y'all ladies don't have a problem. Yes, ma'am.
When you're doing it for the migraines, were you switching hot cold on the feet, or were you?
No, ma'am, just hot. So here's physiologically what's going with the hot. For the migraine. Your migraine medicine is a vasoconstrictor. Your ice water is a vasoconstrictor. When we're squeezing that blood out of the head with that ice, it needs somewhere to go. You don't want to congest the organs. You want to make it easier to make a place for that blood. So when you do hot in the feet, it causes vasodilation down there and leaves room for the blood to go. Does that make sense? So that's what we're doing there. All right. Thank you, man. Thank you. A neti pot. Who's ever done a neti pot?
Yes, I love it.
Y'all like neti pots? The great ones. The squeeze bottle. Yes. Now, Kellogg, they didn't have these kind of neti pots back then. Has this been opened? Is it okay if I open it? No, I don't. I've literally gone up before, forgot something in my pocket, and I go, uh-oh. As I mentioned yesterday, Dr. Sines, who used a dentist down in Chattanooga, he told me that he never got any problems because he would do this when he went home every evening. They make neti pots. This one's a plastic one, so you can drop it, it's not going to break. They make them that's ceramic, or some, I'm not making them ceramic, what is it? It's something that breaks. And just a great little tool. It's called nasal hygiene. Nasal hygiene. And in India, they use nasal hygiene like they brush their teeth, like we use oral hygiene. But what you do is you put your saline in here, and you can use these little packets, or you can make your own normal saline, your own saline solution. And the way you make saline solution is you take distilled water and you say a pint of distilled water. This is 8 ounces, and you're going to use a pint, 8 on each side. You take a pint of water and put 1 teaspoon of salt, and that will make saline solution. Now, back several years ago, CDC was found that there were some folks down in Texas that were dying from nasal irrigation. And nasal irrigation is used in regular medicine. And so CDC put out a warning that any nasal irrigation, the water should be boiled first. There were some pathogens that were in the water that got to the brain and killed the people. And so it's a real simple, boil the water first, and then you won't have a problem. They even found that the chlorine in the city water was not killing the pathogens down in Texas. I only heard of it happening in Texas, but I mentioned to ReachMD a lot, and they were coming across talking about that, warning that all nasal irrigation, the water should be boiled first. Whether it was just regional, I don't know. But you can take your water, 1 pint to 1 teaspoon of salt, and you've made your saline solution.
Now, kind of salt?
You can use Morton's on that. You can use your Celtic or your whatever kind. But you can do other than just saline solution. You can use golden seal if you have a sinus infection. And here's how you do it. You make your golden seal tea, and then you pour it through a coffee strainer. That's the only thing a coffee strainer is good for, is straining stuff like this. And you don't want that golden seal powder or whatever up in your sinuses. And so by pouring it in the coffee filter, you're going to collect those golden seal granules. You can then take a spoon and scrape it off the coffee filter and eat it, put it in water, whatever, so you don't waste, because golden seal is expensive. Dr. Jackson, you know Thomas Jackson? Jackson found that using molasses actually gets rid of nasal polyps for some patients. Well, you don't just use plum and molasses, you know. Take that pint and put a teaspoon in the pint. Stir it in there. Make sure it's stirred very well and dissolved. And then he would use that, and he found after about 30 days, he was able to get rid of nasal polyps.
Plus the salt?
Pardon?
Is that plus the salt?
No, just the black strap molasses. And then when I use the golden seal, I use just the golden seal. But normally the saline solution does the key. Now the question was a bulk syringe. Now Kellogg did nasal irrigation. He used enema bags and used the tip. Now you want to make sure you wash that tip off really good if it's not a brand new tip. But he did not recommend piston syringes. They didn't have the bulb syringes back then. He didn't identify them. But he did say that people were using piston syringes for nasal irrigation. And he found that it could damage the eustachian tubes. And so just by the gravity, the simple gravity, it wasn't too much pressure, such as, I wouldn't hang the IV bag, the enema bag way high. But, just this bit of gravity is not going to damage the eustachian tubes. There's another key that I found, and y'all have probably found it also. When using this, if you open your mouth it helps. It's just like at your house, you've got a vent that comes up from your plumbing, goes up into the roof or whatever, and so it causes a vent situation. If you may have your mouth closed, it can go down your throat. And so by opening your mouth, it helps to vent it. Any questions on neti pots? It's a great little tool that you can use in prevention, as Dr. Sines used every day when he went home. It was a great tool during COVID because COVID was a nasal issue. And so you can use it for prevention or you can use it for treatment. It's a great tool. Enemas. Did you know that enemas is hydrotherapy? Now, as I mentioned the other day, I don't like fleet enemas are so small, they're dinky. So you can use enemas for constipation. You can use enemas for my granddaddy, who was a veterinarian. Before that, he was a nurse and worked for Kellogg. And if he went to a person's house and they had a sick horse or they had a sick cow, he would take a glass Coca-Cola bottle, and they were only glass back then. And he would take Epsom salt and he'd make a solution and he'd pour it down the cow's throat or the horse's throat to clean them out. That was the first thing he did when he went to someone's house who had a sick horse or a sick cow, he told me. He said, clean that colon on that sick horse or sick cow. Many times, problems are in our gut. We don't have good transit time. What is transit time? That transit time is when you eat it and when it comes out. Transit time back a number of years ago, average in America was 72 hours. It's probably worse today. I don't know the average today, but I know it used to be 72 hours. It needs to be no less than 24.
Well,
Yes.
how my patients do it with corn.
Yes, that's what I use. So you explain to them how you do it.
I just have, because a lot of my patients have slower, they have gastroparesis, and so I just have them eat corn and watch their stool and see how many hours before it comes through.
Just don't chew it real good, just let it kind of swallow.
Oh, it'll come through anyway.
Yeah. And so that's what I use. I use corn. You can use activated charcoal, but I like corn the best. And that way you know what the transit time is. And there's people who are they're just stove up. And an enema, a Kalima, who's ever used a Kalima board? Kalima boards are similar to a colonic, but just not as aggressive. Who's ever heard of colonics? Colonics are a great tool to clean a person out, clean that colon out. And it's amazing how much better people feel when they get cleaned out. They're just not having good bowel movements. If you want to clean out by mouth, there's a good treatment that you can use. I was speaking last year at a friend's house. He asked me to come over, and he's a gastroenterologist, and he has a big pavilion where he does classes at his place. And he asked me to do one on natural things, and in front of everybody, I said, I called him by name, and I said, I need to confess what I've been doing to your patients for the last 19 years. And he said, what have you been doing? And I said, well, they'll come to me because you're getting ready to do a colonoscopy, and they don't want you to go lightly, they don't want your magnesium, they don't want whatever you give them. And I'll just take a half a gallon of warm water, volume. Who's ever flushed a toilet with a bucket of water? Most all of us done that. So volume of water, warm water stimulates peristalsis. So a half a gallon with about 5 teaspoons of salt in it, sea salt in it. You can put 2 lemons in it for taste, or some bouillon, vegetable bouillon thing for taste. You don't have to have that, it's just for taste. And drink it all within 30 minutes. Say a quart every 15 minutes. Don't try to drink it too fast, you throw up. But if you go longer than, it's like It's like taking a spoon and pouring it in the toilet. It's not enough volume to flush that toilet. And so you need volume by time. And so by drinking a half a gallon, within 30 minutes, it's going to flush the toilet. And stay by the toilet around 2.5 hours. It cleans them out so well. Joe has never, I didn't mention his name. He's never noticed in all of those people who's done a colonoscopy that they didn't do his treatment. And so if you want to flush it out real good, it works well. But if they're constipated, don't do that. Do the enema first. Use soap suds, oil, something. I don't mean just oil. You can put some oil y'all know what I'm talking about. Like you can get a Fleet's enema that has oil in it. And you can do the same thing in here. And put a little vegetable oil in, olive oil in it, and kind of slicks things up a little bit. And also you can do, to help that, is you can do a massage. Now you do colon massages. Well, guess what Kellogg used to do a colon massage? Cannonballs. Cannonballs. He would take a cannonball, wrap it in leather, sew it like a softball, lay it down here, down where your appendix, and roll up the ascending, across the transverse, down the descending, pick it up, do it over and over, and similar to what you do when you do a colon massage. You're probably going this direction.
Yeah, it's go clockwise.
Yeah.
It starts around close to the belly button, and then I just keep working out further and further.
And that gets the bowels moving.
Yeah, it's nice firm pressure.
Now, when you do let's say you want a retention enema, the colon is not used to things going the opposite direction. And so it says no, and it wants to evacuate. Well, here's how a trick to do the retention enema. First, don't sit on the toilet because gravity. You're trying to make it come up. That's just gravity wants to pull down. That's just plumbing. So you can lay in the bathtub or on the bathroom floor with something under your buttocks, with your feet up on the wall, and so your gravity's going backwards, so it comes this direction. Now here's the trick on the enema bag. It's got a little clicker thing on it. Remember the clicker thing on it that turns it on and off? Okay. You open it up. If you leave it open, the colon's going to go no and evacuate. But what you do is you open it up, and all of a sudden your eyes go, turn it off. You literally can feel it in your eyes. And so you calm down, turn it back on. When your eyes go, turn it off. And that way you keep getting it in, and the colon doesn't just force it out. It is true you can train the colon. Usually the second, third enema, the colon gets used to it. But enemas can be very valuable. If a person's sick, to clean that waste out, if they have a fever, if something's going on with them, or if they have cancer and you're putting a T in there, you want a retention enema, you can do that. We don't see enemas done in healthcare as much anymore. Why? It's nasty. The staff just don't want to mess with it. They just won't mess with it. In those little Fleet's enemas, they're just not very much fun. Okay, let's talk about some others that we can do. So if you want to make a sauna, the old way of doing it, without electricity. Now, why do we need to know how to do it without electricity? We may not have electricity, and we kind of experienced this last week. We had no electricity, we had no telephones service, we had no water, and people were freaking out. Do you know what people do when they don't have cell service and they can't find something on their phone? Especially kids, teenagers, 20-year-old folks. I mean, it was like you cut their umbilical cord. It was amazing. I mean, they had no knowledge to get information. Nothing was stuck up here. You know, they depend, you know, we need to put stuff up here, and their brain is here. And this was not working last week, and still not working in some places at home. And folks didn't know what to do because they couldn't go to this to get information. You may not always have this to get information. I like books. That's why I like your bookshelves. Mary Lou, she says, more books? Yes. I may not be able to have a computer someday. I need information. And so there may be a day that you don't have electricity to have a sauna. So how did they used to do it? They used to take a pot and they put hot water in it, and then they put hot rocks. Now do not use rocks out of a creek and heat them up. They can explode. You have to have rocks that are on dry ground. And so what they would do is at Battle Creek, when they first started, they would take a pot, put water in it, put hot rocks in it, put it under the chair. Then they would take a towel, so that the steam doesn't burn the legs, because your legs are there. Let's see here. All right, good. Oh, good, some more supplies. Okay, our fellow over in the far side, can you help me? If you can sit down.
Yeah.
Now, what's the first thing we do? We pray. Exactly. Yeah, thank you. Oh, good, thank you. You can take a safety pin. Sorry. There we go. I'm so sorry. Okay, so then you're going to put an ice pack on his head, and then you have a fire over here that you have your rocks in. And then you will, when it starts to, the rocks, it starts cooling down, you pull it out, pull that wet rock out, and then pull this rock out and put it in there. And you just keep those rocks in there, keeping that steam going. And that's how you can do a steam bath. Now you may not have ice. You at least have cold water. And cold water is contrast. That still keeps it cool. If you got a creek, that's going to be cold water. If you have a well, that's going to be cold water. If you have a well that you pump or whatever. Kellogg, what do you think he would use sometimes in the winter for cold? Snow. Yes, I've actually used snow just to see what it was like as a cold vent friction. I was in Sweden last year, and it was in the winter, and we had snow. And we were doing hot and cold fomentations. And I was doing snow as the contrast. Yeah, it was cold.
And Idaho Cold Creek works just as good because I've done it that way.
Cold Creek works just as good, yes. So let's say that you're a little more modern and you don't have to use the rocks. What can you do? You know those little electric eyes? That's a one-eye electric. Have y'all seen those? It's got one eye and it plugs in.
A hot plate.
Hot plate. You know, it's electric.
Yeah.
Is that what y'all call them? Hot plates?
Yeah.
One, yeah. And you put it underneath and you put a tea kettle on there. The reason folks don't use those, they get moving around and knock it over and it put them around circles in the carpet. They burn the carpet. But they work fine as long as you're careful. And you can use this for generating that steam. They also make them like this, that's you plug in. And that one works very well also when you're wanting the hot steam. Now, is there something else that we can do that I like better than the blankets? Thank you. Is you can take a thick piece of plastic, like you would, you can go to Walmart and buy this roll of plastic. It can be clear, it can be black. You can use a tarp, and you're making like a poncho, and you cut a hole in the middle of it, just large enough for the head to fit through, and it just lays over top the person, and it lays on the ground. I like clear, because I like to see what's going on with the tissue. I want to see what color it is. I want to see what's going on. I want to see they're sweating. But a lot of times people don't want you seeing what's going on underneath. And so we'll put black. And that works very well. It really does. I mean, they make some really thick ones that you can just, get the thickest mill of plastic you can buy, and you can actually sew it where you will a drawstring where you tighten it up a little bit. And then you can put a towel around the neck, and I should have on him even on this, put a towel around the neck to keep the heat from coming out. And that's a great little tool that works better than these guys here. Some calls I have to take and some I don't have to. So that's a way you can do what's it called? A sauna. Yeah, a sauna. And now the ways I would do saunas, if I want to really get aggressive, and I wanted to, you can just do a sauna, you just do the sauna by itself. Or you can get more aggressive. I had a guy come in, he was around 55, 56 years old. He looked like he was well in his 80s. He worked in a factory that made the chemical that's in the electrical transformers, that's a step-down transformer that comes to your house. And I forgot the name of that chemical, it's letters. And he was toxic. And the lab showed him toxic. It was into the fat tissue. The best lab at the time was down in Texas, and we sent his labs off, and we did this treatment, and literally we were able to get the toxins out of his fat cells. And here's what we did. We put him in a hot shower to heat him up, and then we put him in a sauna. The sauna was for 18 minutes. Put him back into a shower, a minute hot, and then we turned it as cold as he would tolerate for about 30 seconds. Put him back in the sauna for 12 minutes. Put him back in the shower hot for a minute, and then we would be able to go even colder. The body allows you to get even colder. Then we put him back in the sauna for 8 minutes, put him back into the shower, and then we turned it plumb cold. Now, if they have a history of cardiac issues, do not turn it plumb cold. You can put them into angina. And so just turn it, we usually go around 70, 80 degrees because you don't want it 55 degrees or what you could cause them to have some cardiac issues. And then we put them in bed. And what that would do, that hot, cold, would cause it to come out and then sweat out. And then you go back in, and we just kept doing that every day. And we were able to get those toxins out of his body. And it's just a great tool. I like using saunas that way. It was interesting, we would take smokers. And normally, who's ever done stop smoking programs? Anybody?
Done what?
Stop smoking programs. It's been a long time, yeah. Normally around day 3 to 4, the family starts begging them to start smoking again. We cannot deal with you, just start smoking. Go back. We can't deal with you, Mom. We can't deal with you, Dad. When we did this treatment on them, the sheets or the towels would be orange in color. And they were sweating that out. But you know what? Not one of them had withdrawals. And that was so cool. So they didn't have to go through those withdrawals that they were doing. All right, thanks, sir. All right. Yeah, I need to get your hand back. Thank you. Now, fomentations. Any questions on the sauna? It's a great tool that works very well. Do we have a young and wicked bar that would help us? Would one of them help it? Allow us to put them on the table? Yeah. Perfect. I think it's good to get these old guys involved. They learn. All right, come here, buddy. Come here. Can you help me? Can you help me? All right, good. So I'm going to put you up here on the table, okay? And you're just going to lay real still. Yeah. All right. Yes. Farm boy, that's right. Okay, so when you do fomentations to the chest, there's 2 ways of doing it. You can either just do the front, or you can do the front and the back. We're going to do just the front at first. All right? So, first thing is you put a barrier towel on the chest because you don't want to burn them. Then you're going to get a towel. Now, this is the only thing a microwave is good for. When I learned that microwaves kill approximately 80% of the nutrients, when I found that microwaves, you lose, oh, thank you, that's very nice. Thank you. Microwaves, you lose more nutrition than deep frying. Wow. I got rid of my microwave. And then I go, wait a minute. I need that for hydrotherapy, so I went and got me another one. Again, we're not going to have electricity forever. So if you don't have electricity, you can go back to the old way we did it, and you put it in pots. And you have tongs. Remember the tongs that we use for pulling things out for canning or whatever? And you pull those out, and you have a big old rubber gloves on and wring it out. But it's a lot easier if you have a microwave. and you take the microwave and you put it in a Walmart bag, and you put it you take this right here, dot it down in hot water, wring it out, but not plumb wring it out. And then, that means you don't totally wring all the water out. And then you put it in the Walmart bag and put it in the microwave. Now the microwaves are different based on your microwave. You just heat it up good. If it's too hot, it's not a problem. You just put another barrier so they don't burn. And then what you do, you put it on the chest, and then you put a blanket on top. Now what's the first thing we do? Pray. You leave it there for how long? 3 minutes. Then you can either do a cold compression, or you can just lay it there plumb. And so if you did a cold compression, you ready? All right, I'm gonna go real fast on your chest, okay? Real fast like this for about 30 seconds with ice water. I do it 15, put it in there again, get more ice. Just real fast. Or you can just take it and just lay that on there for 30 seconds to a minute. Now you're going to get another hot towel. Now when you finish, you don't want to put the heat onto moisture. You just dry it off. And then you're going to put your barrier towel again. And then you're going to put your hot fomentation again. Then you're going to put your towel, your blanket in. For how long? For 3 minutes. So you repeat this over and over, 3 minutes, 30 seconds, 3 minutes, 30 seconds, 3 minutes, 1 minute, whichever you want to do. And you do that, I like 7 times. It takes time, but it's well worth it. Now, if you want to be more aggressive, this is a revulsive treatment. And you can even put the feet in hot water, the one's just on the chest. But when you're doing double, you want to put your feet in hot water. Bend your knees up. There you go. Now we're going to lift this up like this. Place the feet down in here. It's kind of weird, isn't it? You can put ice cloth on the head. You can put hot down here. And so what we'll do is, let's say we put it on the chest, but well, let me do it this way first. It makes more sense. Okay, so we're gonna have him sit up. Sit up. Okay, just sit like that. Good job. We'll put the hot one down first. We're gonna put the barrier towel, so we don't want it burned. Then we'll let you lay on back. There you go. Then we're going to put the barrier towel first. We'll put the fomentation on here. And then we'll put a blanket on top. And we wait how long? 3 minutes from when you did the back. Then, what we're going to do, put your arms
3. Good job. Okay, hold it. Then we'll take this away, and we take the cold mint and friction to its back, dry it off, put your your barrier laying back down. Now it's time to do the top. Make sure the rag stayed on his head. Cold mint and friction. Again, the barrier. The hot. The hot, and then the barrier. I mean the blanket. And you just keep going back and forth. Check your water, make sure it stays hot. If it gets a little cool, pour some more hot water in there. And then keep this good and cool. Again, ladies kind of like their head kind of massaged. I like my head massaged too, as Mary does. And then, and you can talk to them, you can sing, you know, you can be heating up some more fomentations. When you're finished, what you'll do is we'll sit on that. We'll take this away. The cold mint and friction. Cold is always last. Do the cold mint and friction. We'll dry it off. Have him lay back down. We'll do the same to the chest. Cold mint and friction. Dry him off. And then we lift up his feet. And that container of ice water, we're going to pour it over his feet. And then we're going to move this out of the way so it spills on the bed real easy. Dry them off. And just go ahead and lay on down. And then we're going to cover him with a blanket and leave him there for 2 hours.
Nice. Fall asleep.
You want to stay there for 2 hours? Okay, good. So, if you're concerned about getting the bed wet, what can you put on the bed underneath it? Plastic. You can put a shower curtain. You could put a plastic bag, something to keep the bed from getting wet. Okay, I've got one more. You ready for it? Will that work? Okay. We gonna try another one? Let's try another one. Come on. Okay, now this is called a wet sheet pack. Okay, we're gonna plumb get up. Stand up. There you go. Okay, stay right there for me. This is called a wet sheet pack. Is this fun? Right. Now, wet sheet pack is a really neat kind of thing. And let's see here. If you can help me fold this. We're going to fold this like a salvage cover on the fireplace. So what we do is we lay it, it's kind of hard here, but we're going to bring this into the middle. We're going to bring this into the middle. And then we'll fold over like this. And then I'm going to roll it up on my side. Now, I'll let you help me with this. It needs to be a little taller than our little fellow. Okay. Now what you're going to do is you place it in ice water. It works for patients who cannot fall asleep. I had a man who came in with sleep deprivation, and his mental status was not good. We couldn't get him to go to sleep. He went, he would take and he broke lamps. He would throw chairs. He was just going nuts because he couldn't sleep. He ran off and tried to drown himself in the pond. Well, I prayed, God, what can I do to knock this man out? And I was impressed to do a wet sheet pack. and it worked. Hello, y'all. So, what we did, now let's see if we can do it here. Let's just go over here. Okay, so what you do is you take this, if you can get on the other side of the table, see if I can keep this thing together. And you roll out your tarp, your sheet. And we're doing this as fast as we can. And then where do we go? Here we go. We open it like this. We grab our 2 tabs. And now, we grab our patient. Everybody. Okay. And we are going to tuck this, and it's going to touch every piece of his body from the neck down. Under the arms, in the groin, everywhere. I mean, he is covered up. Then we take we're going to put a blanket on him. Is he cold? Ice water.
Ice water.
Is he cold? Yeah. Absolutely he's cold. And so what does the body do to deal with the cold? It sends blood. And now it's going to send blood just to the outside, to the skin areas, and he's now going to get warm. And a lot of times he's going to fall asleep. They use this treatment also in psych wards, where patients are just going nuts on them, uncontrollable. They will put them in a wet sheet pack, and it will calm that patient down. But if you want to generate circulation to the extremity areas, to the surface area, this is a great way to increase that circulation. It's just a wet sheet pack. Feel pretty good? All right, and they stay there, they fall asleep. Another case, you don't leave them, because you've tucked him up really good around here. He tries to get up, you don't want him to fall and break a hip, break his neck, so you stay there with the patient. Again, ladies like their hair massaged, and they'll fall asleep a lot easier in this. You might have some soft music. The therapist may sing or read some Bible verses as they fall asleep. You good? All right. Thanks, sir. And that's called a wet sheet pack. Got it? Good job. All right, we've got about 5 minutes left. Let's try another. So this one, okay, you can have a seat. You're the patient. Now remember, whenever we work on somebody, we have to pray to Jesus, that Jesus will bless it. Now we're just practicing so we don't do a real prayer, but if she was sick, you always pray and ask Jesus to bless it. Make sense? Yeah, okay, hang on a second. So we're going to take a handkerchief. Fold it about this size here. Now, think you can wrap this around her neck? Pull your hair back. Okay, now you're gonna come over here. You got it? You're gonna put it around, and okay, right, and you're gonna hold it here, and we're gonna put it like this. Put it like this. Now hang on. I'll do this. Is that okay if I do it? Okay, we're going to take a safety pin.
He's doing it.
I'm doing it. You're good. You're good. I'm not going to hurt you. You okay? Okay, good. Okay. Now, this is ice cold. Got it? Ice cold. Now, you could put a piece of saran wrap around it where it's not as where it won't leak as well. You bring some socks, those other socks. Oh, here we go. So, you could put some saran wrap around it so it doesn't get as cold, but you can get like we're using this as an example. Usually use something like a tube sock or a piece of wool. Okay, we're gonna wrap this around her neck. Right, got this? Pardon? So we're gonna do this again, and then we'll pretend that I put a pin right there, and you leave that on there. Now, the handkerchief is ice cold, just as a wet sheet pad. This, the sock, wool sock or whatever, provides to hold that cold there. What's that gonna do? It's gonna bring blood to the throat. And that's gonna help heal. Blood is the healing, and that works great for a sore throat. And you can go to bed, go to sleep with it, or wear it around the house today, and just leave it on. And that will help circulation. Pretty cool, huh?
Would that help thyroid problems?
You could, for thyroid, you could try that. You can also do a charcoal poultice, a castor oil pack, or a bentonite clay pack poultice. Any of those three. Okay, you want to take these off? Okay, take this off. Good job. Okay, now you're going to need to take this off. You okay? You pull your hair. Okay, well, then take this off. There you go. Now you're going to pet her on the shoulder and say, "Good job, sis." Thank you, guys. So these are just some examples of hydrotherapy. Can kids do it? Yeah, they can do it. You can teach kids to do hydrotherapy. And they can, did the Waldensian kids do stuff? Yeah, they did. I mean, think about when we were kids on the farm. Did we do stuff? I mean, I was, at 16 years old, I was taking cattle to the stockyard in the truck. I mean, kids used to do stuff like that. I mean, you're driving tractors as a little kid, bush hopping, disking, whatever. When kids need to be involved, they need to learn, they need to be part of, and they can provide help to a sick mom or a sick dad or a sick sibling. Just as we teach them to wash dishes, we can teach them to do hydrotherapy. Any questions on hydrotherapy? Yes, sir.
What about, is there any, you're having a lot of lately about cold water?
Yes.
Like cold shower, cold water, cold lake, whatever, is that, what do you think about that?
It's very beneficial. And let me show you the benefits of that cold. Now, my wife is from up near Canada, and they're plumb crazy. They will, January 1st, they go cut hole in the ice, or break the area, and they will go down in it. It's they call it the polar plunge. Do they do that here?
Polar Bear Club.
When I was at SMC, the guys would do that. I only did it once and said, "Guys, this is crazy." We'd get in the sauna, heat up as much as we could, and then we had ice in the bathtub and jump in there. It was crazy. When I went to Alaska, they would in the wintertime, they would do the sauna, they'd roll around in the snow, get back in the sauna, come back out, roll around in the snow. They do that in Russia also. In the summertime, they take this real cold water that they have in Alaska and pour it all over them. Then they get back in their saunas. But let me share with you, I think I have it here. No, it's on another one.
We looked at this one yesterday, but I'll read it again. So, it's not working. Okay, so the benefits of a cold shower or cold bath, it strengthens the immune system, increases hormone production, improves circulation, increases metabolism, alleviates depression. This is Dr. Jockers. It's a detox, improves male fertility, speeds up healing, prevents post-workout injuries, increases chronic pain, reduces body aches, improves your hair health, improves kidney function, reduces swelling and edema, heals and tones the skin, regulates your autonomic nervous system, regulates uric acid levels in your body, improves sleep. When you take a shower, I can tell when Mary Lou is finished with her shower. She's hollering. We live up in the mountains, we got a spring, and so we have spring water, and it is mountain cold water. And she's downstairs hollering. And I know when she's finished. Dr. Schultz, who's ever read Schultz's work? Schultz says if you ain't screaming, the water's not loud enough, or not cold enough. So the cold water is very beneficial, closing the pores, but also increasing white cell count. Yeah. Yes, ma'am.
So I have a hot tub and then an ice sponge. Is there effort going back and forth?
Yes, so you can be in the hot tub, going to ice plunge. The hot. Yeah, say 3 minutes, 1 minute. 3 minutes, 1 minute. You can go longer in the hot. Now, here's the thing. If you do cold longer than 20 minutes, it will do the same effect as hot. So physiologically, the longest textbook says is 20 minutes on cold, and then you'll have to go back to. So people will do, they'll do, cold treatments, and you don't want to go longer than 20 minutes. Don't worry about that, huh? Ain't gonna happen. Any other questions on hydrotherapy? All right, well, let's talk about what we're gonna do right now, and then we're gonna come back and